Okay.
Perfect.
All right, we reviewing the agenda. Let me know if we want to add something to the agenda. All right. So we're gonna move on to approval of October 8th, meeting minutes.
I move to approve.
Second. All agree, say aye.
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 All right, we're gonna move to public comments. Any public comments? Anybody wanna speak? Please raise your hand. I don't see anybody, right?
This person that's Karen's iPhone has her hand raised. So I don't know if she's done that for public comments.
Okay.
It's just showing differently.
Yeah, it's up to, can you unmute?
Karen
Karen's
iPhone, if you'd like to speak, you have 3 minutes.
Well, gotta unmute her.
Can you hear me?
Yes.
There we go.
Okay, can you hear me okay?
Yes.
Yes.
All right, this is Karen Buck. And this is the public comment portion, correct?
Correct.
Yes.
Okay, I have a question for Dr. Reedy. On or about October the 7th, the Jefferson County Board of Education delivered a check to you for $20,000 taxpayer money, supposedly for childhood vaccinations. This was paid out of the school excess levy, which we thought was just for teachers' pay. And this was check number 220963. My question is, exactly which vaccinations was this for? Is it to pay for vaccinations at vaccine clinics physically in the schools? And has the Board of Education ever paid the health department money for anything? Second question would be, Dr. Reedy, do you have any financial interest in Pfizer, Moderna, or J&J? Thank you.
Okay, so we don't usually discuss with the public in the meeting. Dr. Reedy will spend time to talk to you. If you like, you can leave your contact information on the Zoom comment section. And
Okay.
try to reach.
Okay, I will.
Anyone else want to comment? Okay, Karen, you may want to push the button to put the hands down because I want to make sure
Gotcha.
everybody.
All right. Thank you.
Thank you. All right, we're gonna move on to unfinished business. Update on vaccine.
Oh,
Vacancies.
Oh, I'm so sorry. I am
So
very blind.
right
I need to
now-
get used to my glasses.
Right now, we
Vacancy.
have 2 vacancies, the sanitarian, so I just got a referred list of applicants for that on Monday, so as soon as I have a chance to work through that list, I will. I was out of town Tuesday and Wednesday for a class. Is there 2 leads? We only had 1 lead, so there's 1 vacancy, but I'm also trying to add another position with one of the grants. So using grant funding to add a position for a 4th sanitarian.
Gillian, I'm sorry, it's hard to hear you. Could you repeat that, please, of what the vacancies are and what we're adding?
So right now we have a sanitarian vacancy and we still have one of the office assistant vacancies at the front desk. Those are our 2 vacancies right now. I got a referred list of sanitarians on Monday. That was advertised. We advertised that quite a while ago and I just got the referred list on Monday. So I'll be working through that for interviews and trying to hire somebody. I'm also trying to use grant funding to add another sanitarian for 2 to 3 years, depending on how long the grant funds it. And the office assistant position, where I'll let,
We're in flux on the office assistant position. Right now, we're possibly anticipating an inside transfer, so someone from another position to the position of office assistant. So when that decision is made by that individual, then we will either decide to fill the office assistant position if they decline it. If they don't, if they do take it, then we'll have to fill her current position, which is an LPN position. So it's a little more difficult to fill that than the OA position. So we'll see. Once we have a final decision on that, DOP contacted me beginning of this week that they're trying to expedite that, understanding that, you know, being down an office assistant, not being able to hire it in timely manner is really hampering our ability to perform at the level we expect. So they said they'll get back to us as soon as they can, and we'll see.
Didn't you hire one office assistant?
We
Yes.
did, and she's turned out to be fantastic. Quick learner, enthusiastic, tremendous attitude, and very, very happy so far. Great hire by Gillian.
All right, so now that you've been hired, what's the division of the responsibilities?
So I think we've settled on, and is that I'm the administrator, and she is the head of the environmental health side.
Okay, so.
How's your meeting going? What are we doing? Playing the Christmas trees?
Can you please mute yourself?
Is there some sort of chart?
There is. So my direct supervision is over Gillian, the head of nursing, Wendy, and also Mason. So that's my 4 direct supers, while she's maintaining complete supervision over the environmental side and all the sanitarians, including the administrators, the administrative staff on the environmental side.
Sure, thank you.
And he is also the supervisor of the administrative aspects for nursing.
Yep.
Clinical aspects. I'm in charge of that.
You have a lot of responsibility.
It's fun. I've enjoyed it.
So what does Dr. Reedy fit in hierarchy?
Dr. Reedy and I would consider us partners. Dr. Reedy he's the clinician. He's the doctor in charge of the clinic and making the those type of decisions, the doctor decisions, making sure that the nursing staff is following the rules when it comes to administering vaccines and that they're up to date on all those things. He's done a great job.
And as stated in the state code, is the board hires the health officer who's responsible for the operation for the whole thing. But of course, hire other people to do a lot of it. But before the buck stops,
Correct.
Okay. Fair enough. Thank you.
Anything on the vacancies? Anything else?
that's it for the day.
Yeah, I have a question on the sanitarian. Is that a position that's been open for a while, or did we, because I know we have one person who's been going through the training. So is this a position that's been open for a while, or is it a new vacancy?
It's a new vacancy. One of the sanitarians that had been on staff since 2018 recently left. So she
Okay.
took a position in Maryland.
So with that, and maybe this is more appropriate under new business, but I just wanted to ask if maybe we could have a briefing for the board at the next meeting about the sanitarian job. It's actually one of the questions I get out in the community other than on vaccines. People always have kind of comments about and questions about all the different types of, permitting and all that kind of thing. And so I was just wondering if we could maybe have a briefing next month about sort of the sanitarian's duties, the process, what do they do on a daily basis, all of that kind of stuff. I think it might be helpful. I know it'd be helpful for me, and it might be helpful for others on the board as well, especially since we have we've got a couple of us newbies.
Okay.
Okay, we can move on to revised proposal to the state personnel board.
So I did provide each of you, Karen, I'm sorry I didn't send it out before the meeting, but I'll send you the copy. We did receive a letter on October 28th from the state personnel board, and I listened into the meeting that was that same day. But they, at the state personnel board, they did approve our proposal to get increased starting salaries for several of our positions. So, and this letter details all the positions that were affected by that. Only one person that we had recently hired into these positions was currently under that salary, so we had to bring that position up to that salary. So, which is good because the salary that this person was making was definitely not enough for what the position entails. Any questions?
Any
about that?
question?
So do we need to take action on that? No.
No, you had already approved the proposal to the board, so the board approved it, and there's no further action that needs to be taken on that.
So this letter from the West Virginia Division of Personnel kind of answers all those questions anyway.
Yeah.
Very good, thank you.
All right, we're gonna move on to DHHR Graham's update. And that we have public health crisis response grant.
You want to discuss that?
Sure. So that is this is a new grant. I guess that came out in October, maybe a little bit late September. So we filled that out. Gillian and I, it was pretty much one of my first grants that I've worked on here. And it is a retention, like a supplementary retention incentive grant. So we decided, her and I, that we would include our full-time employees that were on hire at the date that the grant proposal was submitted. And so it was 11 people, and it's roughly $61,000 for divided among 11 people, of which we will remove roughly about $5,000 for personnel fees, of like paying out the Medicare fees, the Medicaid fees, and obviously our portion of the organization's social portion of Social Security. So that was allowable under the rules of the grant. So we don't know when exactly that'll be paid out. I just received confirmation that everything was on the up and up. We have to make some slight modifications. I'm not a CPA, but evidently you're not supposed to figure the Medicare, Medicaid amounts and Social Security amounts on the full amount. It's only on the amount that isn't portioned out for Social Security, Medicare, Medicaid. So we actually charged a little too much for that. So a little bit of that will go back to the 11 individuals who will be compensated, and so we'll have to fix that up today and submit for final approval. So far so good. We're getting better. Now, at least I am. She's already knows what she's done.
Yeah. So for that retention incentive, the only other stipulation with it is that the employees all have some COVID-related duties, you know, and in the future, and all of our staff has been doing something related to COVID. And
So has this grant been
continue to.
approved?
We're still waiting on final approval from the grant. So at one point we thought we needed the board to vote on it. I don't know.
So that is something that they're trying to finalize, whether or not the local health boards have to approve the grant to be paid to the individuals. But it's sounding like the Department of Personnel or the Division of Personnel right now is saying that under the emergency order from 2020 from the governor, that we, the administrator, has and the health officer have the final say on that. It doesn't have to go through the board.
So you don't think it'll have to go back through the Department of Personnel like we did with the other?
That's what they're saying
That's what
right
they're saying
now,
now.
because they're saying because we're still in this emergency
Yes.
state, that they're allowing it to happen without DOP approval.
Okay.
So if it did need DOP approval, we would need the board to vote on it like we did.
It shouldn't be a problem either way.
So that's a nice one. As we know, the staff's been working very, very hard and pulling a lot of long hours, and it's nice to maybe compensate a
We
little
really
bit for that.
appreciate it. All you guys.
This one will give each staff number that is included a little over $5,000, so minus that.
Of course,
Yeah.
Remember,
So,
the
did your
bonus, you have
11
like 50% tax.
Yes. It's not a bonus.
No.
It's an incentive, protection
does-
incentive.
It does end up being, well, we don't have to take retirement out of this, but it should be a little, they should get a little more of that money than they did last time. So.
I'm sorry.
Does that 11 include the one that left though?
No.
No.
Okay.
No.
They're all currently
So
staffing,
I
they're all
already
currently
had
full-time.
her notice when we got approval for this grant, so I did not.
The timing was really good, actually, the day we did it, so.
Is there anything else on that? Okay, so we're gonna move on to employee time tracking software.
So,
I did want to bring up two other grant items.
okay, oh,
We,
absolutely.
the quick response team, which is the response to opioid overdoses, that's being finalized at the state level. We're just back and forth on some punctuation issues, and hopefully that's going to be approved. That's something we've done before, didn't do last year. We modified it, advice from the state to include the social worker position. And then there's another grant submitted next week, which is COVID response. It's not very specific about one thing, but COVID-related activities for specifically for ethnic and racial minorities who there is some disparities. That's a relatively small thing, and that it's actually a good segue for the health department into responding to that, because we know there are differences throughout the society. So it's so we're working with other partners on that. And that would be a one-time, one-year grant as far as we know. So probably will not involve any new permanent staff, but some different contracts.
I have the question on the quick response for the opioid. Is that the same as the harm reduction grant? that
It's,
they have?
it's separate. This one is specifically about people who have had overdoses and survived, just trying to reach them quickly within a day or two to engage them with regard to the needs, such as having naloxone available for their family members and seeing if they're interested in getting into treatment, establishing some rapport with them. The harm reduction is a term used that a major part of it is the public part of it is the syringe exchange program. So we do not have that at present. If we were to go for that grant, they've changed the rules at the state level. Legislature changed the rules. Governor signed it into law that would require the entire county council to approve it, which is different than other things. So something that is of value, but is very controversial. That we'll discuss that again in the future.
I can see both sides on that, and then
Yeah, we'd rather not deal with this whole issue, but it's here.
okay. So we move on to employee time tracking software. Is that are you talking to you?
So yeah, I met with the MyPay people to discuss that, and it's definitely something that I personally and professionally think that is a value to us. I think it would release some of our staff from what I consider duplicative and onerous data entry. And the staff member who's doing it is much more valuable to the organization than putting in just reprinting and re-putting in numbers over and over and over again. So I think I'd like it to start as early as January 1, if we can. So I'm starting to move on that. I think it'll be easier for the staff in general, something where they can just sign in the morning when they come in, they turn on their, whatever their communication device is, whether it's a laptop or a tablet or a cell phone, however they prefer. There will be no, the determination that there'll be no GPS tracking on that. I don't think that's necessary. We already trust our staff with people's social security numbers, people's private health care information, so I don't see any need to micromanage their day, so I don't plan on doing that. This will give them the ability to manage their hours themselves and do it efficiently, where we won't be having to track them down at the last minute to get a spreadsheet printed off for them and all of that. They can do all of that and submit it all on their own without anybody involved in that. So, and also it'll probably, from what I can tell, it'll make the grant tracking a lot easier and grant billing a lot easier too, by allowing us to not only at the same time input our hours, but also say, currently I'm working on this grant, and they can begin to accrue hours to that grant for whatever they're doing on the day that they're doing it. So
Does this still allow for supervisor review?
you can be completely 100% micromanaged if the supervisor looks
That's
like.
it. I've always reviewed the
Correct, and you will have an option.
And everything to me, and they're the ones that let me know. It's like my staff lets me know when they're going to be out sick.
Yep. So there will be opportunities for multiple administrators on it, not just one. So, and I probably would, not only would it be me, but also you, and also Dr. Reedy would have access to it at an administrative level, because if I'm out or you're out, or any of the three of us, one of us is bound to be here to take care of it if there's something wrong, something that happens to any one of us. So you have to have multiple administrators. So on that.
How much is that ad?
So there's two different versions I'm looking at. One is the MyPay Solutions workforce management software. It's a $200 initial setup fee. It has no month-to-month contract. Currently, based off the fact that we have anywhere from 22 to 24 employees, full and part-time, it would cost $39.60 per pay period. So we're talking about $80 a month, which in my opinion doesn't sound terrible. I think we can, for $80 a month, I think we save, I want to doing this, at least that, at least $80 a month on her not having to do this. You can also do a HR suite, a much more involved one that would actually access the DOP portal, the Division of Personnel portal. So that would be handy. There's another version that goes directly through QuickBooks. It's called T-Sheets or Time Sheets, and that's similar in price. It's $20 a month, plus an additional $8 a month per individual. So when I did the math, they're within a few dollars of each other. Obviously, that HR software space is pretty competitive. They're all within a few dollars of each other. So I probably would choose to go from the MyPay way, just because it looks like it'll smoothly integrate into the payment system that's already there. And you use the MyPay version and it works for you. You find it onerous or easy?
Really easy.
There you go.
Can fix really quick.
Yep. And you don't need supervisor approval to make changes and stuff like that. And it's just really easy I find it a really easy way to manage your hours individually, but also organizationally.
Does the MyPay integrate with the QuickBooks?
It does. It does. So that's another reason why I was like, oh, we should get something like T-Sheets, which integrates directly with QuickBooks. But MyPay is already integrating with QuickBooks, so we can go through the MyPay system and it'll automatically hit the MyPay, and then it'll automatically hit the QuickBooks.
It's not that I don't trust people, but being in the higher level at work, I realize people do things that, unintentionally, longer breaks, and, it's just add on. I suggest that we need to have some sort of monitoring. We can't just let people do, what they want. Sorry, but
we do that now.
People nature, we have to check.
Yeah, we do that now, though. We trust them now. I don't see any reason not to trust them going forward. So,
well, the supervisors do review this.
Absolutely.
Right now, so then I think
This
that's
is
what she's asking.
Yes.
Yes.
No, yeah, if they're members, it's a very small staff. We know who works here. we know who comes in when they come in. I came in this morning at 7:25. I was the second person in the office. I've seen everybody arrive today. So it's not unusual. We know who's moving in and out of the office and where they are. So, and even when they're out in the field, Dr. Reedy will go out with them, or like I did on Wednesday, I went out in the field to Civic Center to make sure everything was on the up and up and we're moving nicely. So I'm not too concerned about that. So
We have very prominent people in the corporate take on vacation for 3 months and on the payroll.
yeah, that's probably a little more difficult because you're talking about a much larger staff. Now I know that these people are in the office because I see them, and so does Gillian. She communicates with her staff on a daily basis, so she knows exactly where they are. And if they don't show up to their appointments, guess who gets to hear about it? So
I don't think Gino's gonna be hesitant to take us to task.
yeah, not in any way.
Okay, so do
not
you guys
necessary.
agree that, whatever system they use, it doesn't matter? Karen, you have any comment?
Actually,
I'll defer to whichever system makes sense. With the GPS thing, I hear you guys, and I just want to sort of underscore the fact that the question around or the interest in the GPS stuff is not about trust. I know that Dave Lutman last month had talked about, from an efficiency standpoint, also, and understanding that. So, I don't know that we completely take that off the table. I think personally, just go forward with getting the timesheet program in place, but I don't want to sort of end the conversation about the tracking because it's not an issue of trust, it's an issue of efficiency, or it's not an issue, it's a question and sort of something that we need to, I think, be responsive given the fact that we are taxpayer funded and these are taxpayer dollars. So I think we want to be able to have that information if ever questioned by the public, and so forth. So again, I'm not saying we must, but I don't think the conversation should be ended, and it's not an issue of trust with regards to employees. We obviously think we have a great team, and certainly don't want that to be the issue. And if you're on number 240, I think you're not on mute. If you wouldn't mind muting. So that's it.
so my thoughts are that Gino, as the administrator, you're the one who's managing the personnel, so you'll have a feel as to who is doing their job properly or not. The software you choose, pretty much at your discretion. What it's there for really is in case something does happen, there's an accountability tool to look back at and see what might have happened by checking the software. But otherwise, it's your job to manage your personnel.
I'm kind of a little confused with what you said. You can go in and correct things later. So what does that mean? Like
Before submission, you can, so you'll have people who, and I think we're all guilty of this, forget to sign in or something on a particular day. You'll still have the ability before submission for payroll to have the ability to add those hours and say, oh, you know what, I was in on Tuesday, and like I said, Gillian and I know who's here and who's not. So, and we'll
it's
be able
not
to
like
no. Once
you
the
clock in and then
no.
you say, oh no,
No.
I was here earlier.
No.
It's changed.
It's more about being able to make. Oh, I worked on this grant, but I put in for this grant, and maybe able to make those changes before submission. Those types of things. So they'll have the ability to do that. There's you can be extremely micromanaging on these types of systems and say, once your hours are in, that's it. They're your daily hours, and if you didn't put any hours for this day, without asking me, you can't change it. And I don't want to be that way with staff. I think what did Ronald Reagan say? Trust but verify, right? So you go down that route and you say, and you trust and but you pay attention, and then once trust is lost, then you micromanage, but not until then.
That's exactly my point.
Yep. And I agree that we don't want we're gonna keep the GPS monitoring in the back of our mind.
Yes.
It's gonna come back in the future. Any other comments on this topic?
Do you need action from us for the expenditure?
I don't think so. I don't see any reason for that, and it's not by any stretch of the imagination in this budget a large cost.
All right, we're gonna move on to new business. Cox Holiday Young update.
Hello, Charlie.
Hi, good morning, everyone. Sorry I couldn't be there in person today, but I do have an update for you. The first thing I had on my list is what Gina just talked about, was the time tracking system. Him and Clyde met with MyPay. The budget presented last month, allocated within your QuickBooks, or your allocated budget. I did input that into QuickBooks, and going forward, if you'd like to see, you can see a budget versus actual. We when we were looking at the bank reconciliations, we did notice that there were some old outstanding checks that needed to be cleared out that dated back to your fiscal year 2018. We cleared those out, but that did result in an increase in cash. And I think you'll see, or what I'm seeing is that cash right now is still a little overstated, and I estimate that to be about $20,000 to $30,000, because there are also some old deposits that we need to clear out of there that that maybe were just inputted twice accidentally. So Clyde did leave a list of those deposits with Marty to research, and we will work with her to get those cleared out. On your balance sheet, we adjusted the employee insurance payable to reflect the current balance. And then we have a meeting with Gino later in the month to discuss the balance sheet, November payroll journal entries, progress on the old deposits that I had just mentioned, finalize the October budget versus actual, and just the timing and logistics of your November board reports. Are there any questions for us?
I love that budget versus actual, or budget compared to actual document. I know I think you shared it last month.
Yes.
So if we could have copies of that for our meetings along with our financials, that would be awesome, because it's really
Absolutely.
helpful.
Yes, you can definitely have that. We'll provide that going forward.
Thank you.
You're welcome. And I know we want to talk about the financials. Do you want to do that now? Or I saw that August and September were later in the agenda. We can table that until then.
We can do that.
Yeah, let's do
Right
it
now.
now.
Okay. So I looked over your financials through October, and right now you have a cash balance of $687,000 roughly. Please remember that is a little overstated by 20 to 30,000. You have a net loss of $54,000, or sorry, for October only, it was $54,000, with a total net loss for your fiscal year of $72,000. So that tells me that, you know, kind of analyzing the information, your income was a little low for October. It was $50,000. And I think that was mainly just due to timing of government support. Your expenses were a little higher than usual, and it looked like salaries were up. But as Gina was saying earlier, you know, your employees are putting in a lot of time, so there's probably overtime in there. Also some timing of invoices for IT services and health supplies. So for environmental health supplies, there were no expenses in the last 2 months, but in October, there was $6,000 of expenses. IT services, in the past 2 months, you had $2,000 of expenses, but $7,000 in October. So I think it's more of a timing thing. But that's where we stand in October so far. And again, that's preliminary. We will present the finalized October at the next meeting.
So the agenda item says review of August and September, but you were actually doing October, which is good. Thank you. So the agenda item needs to be amended to show that that's what we did.
I don't know.
Now,
We
now
do
you-
need to review August and September. That's why it's on there, because every month you're supposed to approve the financials and they haven't been approved for the
Oh, I
last
see.
2 months. That's
Okay.
why that item's on.
Okay, so are we going to approve.
I can talk about August and September real quick here.
Okay.
I'm looking at them right now. So your cash balance in August was $723, almost $24,000. You had total income of $70,000 and total expenses of $64,000. That gave you a net income for August of $5,965. For September, you have a cash balance of $684,000. Total income of $121,000. It looks like you had received some of your state, your government support. Total expenses, $112,000, and that gave you a net income of $9,900.
Right, do we have a motion to approve August and September budgets?
Actually, Anne, I have a question. The grant that we had that we were talking, or the team had shared with us, the new DHHR one for the incentive pay for employees. Is that a strict pay? I couldn't hear everything, so my apologies. Is that a strict pass through to the employees, to the 11 employees, or is there a net positive to us on the books?
It's a straight pass through.
Okay, thank you.
So we'll be removing Social Security, Medicare, and Medicaid from the overall grant, so that it's not a negative to the organization.
Right, it's just a straight pass through.
That's true. Yep.
Okay, thank you.
Okay, since the October report was also given, are we also going to make a motion to approve that too?
No, we approve it next meeting, because the October is incomplete, right? It's only approximate.
Is that right?
I don't know how much it's actually going to change, because the bank reconciliation has been completed to my understanding. But I was told that this is a preliminary report. So we will confirm that it's good and present it next month.
The only other question I have, Karen's already addressed the actual versus budget.
Mhm.
Get a report. How are these numbers comparing to fiscal year 2021?
After this meeting, I can get everybody a budget versus actual for October to review.
Okay.
And please send me any questions you have regarding it.
Are we running, compared to previous years, are we running approximately the same, or are there significant variations?
Last time I looked at it, you were on target. I do not have that in front of me to give you a current to-date answer.
Okay.
Can I suggest, I think that's a great request, Elliot. Can we also have a 2019 comparison, since 2020 was obviously a little different of a year?
Yes, I can do
19 was a little bit more normalized operations.
In fact, maybe
Absolutely.
a 5-year mean average to compare to, so that we see, how, that smooths out the averages a little bit, so that we see how we're doing compared to the previous years.
But this year we still have the extra work because of COVID, so we have to consider that.
Right.
And Gino can correct me, but a number of expenses we've incurred, the grants that would offset some of that, have only just been approved by the state, so we have not charged anything to those grants. So even though they may have incurred the expense, some of them even in last fiscal year, perhaps, but certainly July and forward, we paid the salaries but haven't had the reimbursement for all COVID related.
And I'll discuss that during the administrative report.
Okay, great. All right.
Any other question? Do we have motion to approve August and September budgets?
I move we accept the August and September numbers.
I'll second.
All agree, say aye.
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 Motion pass. All right.
Thank you. Would you like me to stay for the remainder of the meeting?
I don't
Not
think so.
needed.
Not necessary.
Thank you.
Okay, thank you. Have a wonderful day, everyone.
Thank
You
you.
too.
How's the video quality? Is it good?
Wonderful.
Good.
All right, we're moving on to update on COVID-19 activity and vaccination.
So the COVID in our community and across the US has decreased from what it was a month ago. But for the past 2 weeks, it leveled off. It did not continue to decrease. And actually the last few days in Jefferson County, we've seen an increase. We were seeing 10 to 15 new cases a day that we became aware of. But in the last 2 days, we've had 25 and 35 cases. Whether that's a trend, too early to tell, but that is a concern. And nationwide, we see those little blips, and we don't yet know where that's going to go. If you look internationally, every country is different. Europe has gone is going much higher, and even in the United Kingdom, the death rate is going up. The number of deaths is going up for the population. So we're looking at number of cases, but also looking at the deaths, and that disappointing. Last year at this time is when the cases were going up, attributed, as we rationalize why things happen, attributed to coming indoors. That certainly happened. 2 weeks was our first frost, but no one can really predict what's going to happen. In each country, it's acting differently, and the vaccinations, we're seeing relatively few adults and adolescents who have not had a vaccination coming forward for initial vaccines. We still recommend it. The number of booster doses, primarily for those who are older, so 60, 65 and above, it's strongly recommended there because there is some evidence that immunity decreases. So those are available for people who are 6 months after their second dose of either Moderna or Pfizer, or 2 months after a Johnson & Johnson, because their immunity is less. So it is recommended now that they get booster doses. There is still substantial protection from the vaccines, but we are seeing a fair number of people who have been vaccinated becoming infected. Fortunately, for those who are vaccinated, they're less likely to have severe illness requiring hospitalization, ICU, or dying, but it's not zero. So we still recommend, in addition to being fully vaccinated, to do the other measures to decrease spread, and that includes if you're sick, avoid other people, don't share it with them. Masks can help. Being away from crowds can help because you never know who could be infected. So that washing hands, sanitizing frequently touched surfaces, those are not the main way it's spread, but some people forget it that way. So the basic guidance hasn't changed. But no one can predict for sure what's going to happen. I think very few people talk about this being eradicated. It's not like some other diseases that have no animal reservoirs. So there are species other than humans who can get this. So even if there were none in humans, it could come back. The death rate is less than it was in the winter, and the hope is it will continue to remain relatively low, and the number of people in the hospital with this will decrease, and certainly not increase. the hospitals do remain pretty full.
So our immune system learning to deal with this virus.
On an individual basis, there is evidence that even if you've had a natural infection, that the vaccination provides greater immunity if you're fully vaccinated than only having the infection. Of course, each person's different. Still, most of the people who are having severe illness, hospitalization, and death are older. In this case, older would be, above 40, but the older you get, the more likely the problems. If you're above 65, it's greater. Childhood vaccinations from 5 to 11 are now approved. We're partnering with Shepherdstown Pharmacy for those who would like their 5 to 11-year-olds vaccinated. There's going to be an event today and tomorrow at the Covenant Church. I'm going to be vaccinating children. We've already done 40 vaccines here. Other, whether the new pill that's coming out to treat people with COVID, that's in the future.
So the children gonna have lesser dose, but they still have.
It's a lesser dose.
Two
Yeah.
shots.
It's a lesser dose. And,
The statistics I've seen show that there have been 146 deaths among children with COVID. So there are estimates that the potential dangers for children exceed that. So if 146 deaths is tragic, but it's statistically 0 across the cohort. So why would we do this? Why would we take a risk like that?
so
It's up to their parents.
Well, I know, but I'm asking Dr. Reed his opinion.
So the risks of the disease to children are not only death or hospitalization, but having.
But they're extremely small, extremely small, extremely small.
As are the risks from the vaccine, from what we know, but there also can be long-term effects from from COVID. How many is yet to be seen.
But what do we know about the long-term effects from the vaccine? We haven't seen that either.
So it depends on what you mean long-term. If you mean long-term, meaning a couple of years, of course,
I mean 5 to 10 years.
well, no, but we don't know that for the virus either.
Right.
But most of our medications, pharmaceuticals that we approve do not have a 5 or 10-year track record by the time they're in use.
5 years.
So the
5 years, yes, most of them.
but
Absolutely.
the other issue is that other people are at risk of consequences from this communicable disease, including parents, grandparents, and others in the community who can get it and do get it from.
There's no
children.
evidence that asymptomatic people transmit the disease.
There's quite a bit.
I'll show them.
I will show you. There's we certainly have seen cases. We see cases where there's a clear transmission from children, but the level of symptoms sometimes is almost to the asymptomatic. That people have sniffles or things like that, but they do have the virus. But people are infectious with this virus, unlike SARS, where you did not become infectious till after symptoms develop. This one, people can be infectious up to 2 days prior to developing their symptoms. So this is an infectious disease that is still quite prevalent in our.
The literature I have read, and I do my research, shows that transmission from children to others is very rare.
I disagree with that information.
Okay.
Experience of talking to people who have with their families.
So it's anecdotal. The evidence you're citing county code.
No, it's data from contact tracing. And it's,
Okay.
All right, we're gonna move on.
And I have a question. With these clinics that you're setting up, obviously we ran into some not troubles, but who's paying for them? And are we going to be billing through insurance, or how are we going to be compensated for those?
so the vaccine is property of the federal government until it goes in the person's arm. That's their property. So it's not, so we cannot bill for the vaccine. We are encouraged, expected to bill for the cost of administration of the vaccine, but we will not be turning people away who do not have insurance. When we bill for it, we only bill the insurance company. The individual cannot be charged copay, deductible, or anything, only the insurance company. There is a way.
I just want to make sure that we get that bill, because we didn't do that billing last year, or excuse me, earlier this year with the clinics. But I just want to make sure that we do submit whatever expenses we're able to be reimbursed for, to make sure that we do get those reimbursements for whatever we're able to get reimbursed for and not take that loss.
That's definitely a part of these clinics. Yes.
Great. Thank you.
Doing clinics at the Civic Center or just
So
here?
we are. You ready to be available tomorrow?
I might be able to help you tomorrow. Are you doing one tomorrow?
We're doing one tomorrow with Covenant Church,
Yeah.
which will be, so we've partnered with them. It looks like it's going to be a very good event. I'll show you information afterwards.
Okay, all right.
Also, Dr. Reedy, the way that you're bringing the children through is based upon what?
So the children are, so Dr. Christine Knott has spearheaded this effort. Rather than having hundreds of phone calls or trying to schedule, because neither she nor we have enough people answering phones to do that, they're being batched by one school at a time. And so there's a schedule that if you go to a certain school, those who their last name ends A through M come in this half hour, the other half goes the next half hour, the next hour is different schools. For those who are homeschooled or go to a private school, then they would pick the school that would be where they go if they were in public school. So it's really their neighborhood school. Some families will have kids in several grades, so they'll, we're not going to get nitpicky. This is primarily for the Jefferson County residents. We're not turning away anyone who's eligible, but we're not advertising it primarily because our capacity is only so much. We will be having another vaccine clinic at the Ransom Civic Center on the 20th, again for this age group. So there's no pre-scheduling. It's coming at certain times.
One last thing about vaccinations. For the record, I had asked you to send me information regarding Comirnaty, which is not available currently, versus what's out there now under the EUA. And I just want to thank you for sending me what you sent. And for the record, I wasn't convinced because there don't seem to be, verifiable studies out there that could actually state that as a fact. But I appreciate what you did send me. I found it useful. Thank you.
I volunteer to let Ms. Stab people with the needles.
You can sit there and help record the information so you'll be this far from it. I think we get in trouble.
All right, any more question or comment on this topic? All right, we're gonna move on to agency activity report and discussion. The health administrator report.
So first off, I want to say that I'm I feel privileged to be in the position I'm in, but also to work with a very thoughtful and intelligent person, Dr. Reedy. I find him to be a wealth of information. And of course, Gillian is the perfect person to work with, and gives me the opportunity to learn from her incredible experience of dealing with the position in crisis. So, or during a crisis. So thank you for that. A couple things. I know we want to know that we've completed background checks for all our recent hires from the previous few months. There was 26 of them. That includes contract tracers, contractors, and then all our full and part-time staff. So that took a little while, but it came through. And now we've received approval for the COVID epidemiology and lab capacity for prevention and control grant. It's valued at $545,000 over the course of the next 3 years, or it's running from 2020 until 2023. It pays out $54,000, roughly $600 quarterly. One of the things you have to remember is anytime that we receive something quarterly, it's then spent down over the next 3 months, over the next, that month, and then the next 2 months. So it can make the books look a little bit funny. Marty had a system where she would post it and then divide it into thirds to account for it on a monthly basis. I've talked to the CPA and the CPA. So this grant is, it's the big COVID grant, the one, and looks like we'll be able to, we should be able to backbill it, right? On that?
Yeah.
Yeah, so we're talking about a fairly significant injection of funding.
So to speak.
Yes, you caught me. I'm glad someone knows. So we're probably talking about a quick injection of anywhere from like $100,000 to $150,000, and then $50,000 every 3 months moving forward. So that'll be really nice to hit our books. It'll make them at least look nice, and then we can spend it all down again.
So when do you think that first injection will come?
Probably not till the new year. So we're hoping it's sooner, but we all know how government works. It tends to be very slow and bureaucratic, even though they say it's approved. How long do you usually have to approval? Several months? Before you- It's
The invoices, once we bill, it usually doesn't take too long.
Right.
So it's just filling out or figuring out the billing for this one. There might be a complication with the first quarter
Yep.
billing because it overlaps with the last COVID grant. And I'm not sure how many hours we'll actually be able to bill for the first quarter of this grant.
all right.
This will be in January.
This grant started January 2021.
August 1st, 2020. August 1st, 2020.
So this grant started forever ago.
And we just got it approved. So we're talking 5 quarters at least that we have possible billable hours.
But I think it's the first quarter that we're.
Right, because of the overlap with the previous grant, we probably may not be able to bill any or too much to that very first quarter. But going from that first quarter to now, we're going to bill. Another thing, and this is to go to Karen's. Having been in private practice, we all know that billing insurance is part of the deal. So Dr. Reedy and I agree. We cannot bill for the vaccine, but we can bill for the service. And that's what we're going to do. We have been doing and we will continue to do. So that's also another financial number that will come through. Hopefully, insurances can be a little bit slow. It's also not easy to bill CMS and things like that. So we'll do our best to try to get all those numbers through. And we're going to try a new system called what they call line billing, where if you have a particular insurance company, specifically a Medicare, but being able to just send them a spreadsheet with the information they need and be able to bill on the individual line, not have to submit a paper submission or a digital submission for each individual. You can just bill it in a group. So we're going to try to figure out how to do that. I'm sure Dr. Reedy has a comment on that.
Yes, and so just like using Cox Holiday for expert advice, we'd be working with a billing company to guide us, and at some point, if we decide them actually handling the billing, may be better. That's something we explore. They're happy with either options. But it is, it's not simply about COVID. It's all the services we do.
Yep. So that's exactly right. And it'll be, and when we do the training, I'll expect and require multiple staff to be in attendance. Not only is it a skill that we desire here, but it's a skill that they can carry with them wherever they might go to. So it's valuable for not only for us, but it'd be valuable for them. So we'll make sure that we try to get as many people trained in that as possible. So it's not just one individual or two individuals who are doing it, but you know, someone who's experienced with medical billing, it's given me great insight into how the financial aspects of healthcare work. And I think that's something that everybody could benefit from, and just try to get as many people trained in that as possible. On the clinical side, obviously, I'm not too worried about the sanitarians. They have their own job.
I would love to attend to.
Sure, I'm sure we can do
To
that.
learn.
Yep. So that's a great opportunity for anybody to learn that they want to. Really don't have much else. I'm kind of enjoying the job for now.
Out of curiosity, what does Medicare pay for that reimbursement for the service?
So my understanding is it's about $40.
Yep.
It depends on the Medicare product.
Yep.
You know, with all insurances, it's like which one covers what and which plan do you have. But it's home visits. So they have increased their fee through the course of this. That's about it. So it can be more beneficial than using grant funding to do it, and probably simpler.
They
Cleaner.
pay you guys so much more than a routine blood work for our lab.
Yeah.
You mind-boggling if you know how much they pay us to run all the tests, like you run your sugar, your thyroid, they pay less than $40, a lot less. Crazy, right?
So this is not the usual administration fee for most vaccines. It's this sort of one-time.
Is that all paid by Medicare itself and not by the supplements then?
I believe so.
Okay.
I can't answer you the technical parts of it.
But I wouldn't be surprised if we build supplements, if we could maybe get a little bit extra from them, a few dollars. So
I
maybe
do
worth doing
believe,
that.
I do believe Medicare pays the full thing. If you have a
Agreed.
secondary, if you have Blue Cross or something, I don't think it goes to them. I think Medicare.
Yeah.
Well, that's what we'll learn from
That's where the billing specialists
Yep.
say, well,
can only bill it to this and not to that, depending on. You know. We'll find those things out going forward. But we have all the information. We've made a serious effort at making sure that we have insurance cards, identification, make sure that we collect all that information going forward and have in the past.
Any more questions? All right, we move on to health officer report.
so most of the activity still is COVID related, but not all of it. Laura's not here today for the nursing report, but the family planning clinics, childhood vaccinations, influenza vaccinations are ongoing. Not seeing huge numbers of influenza vaccination. It certainly encourage people to get your flu vaccine. We hope it's going to be a mild flu year like last year, but we don't know that. There was a question from the public comment about the check that was actually, to clarify the record, that was actually presented at the board meeting to the board, not to me. I never touched the financials. And the school system has, for a number of years preceding COVID, contributed money from the levy to the health department for the services that we also provide to them. So they have frequent questions about different school issues, things like EpiPens, other kinds of outbreaks, whether it's influenza, hand and mouth syndrome, number of different things that happen in the school system that we interact with the nurses. COVID has increased that. This was in no way tied specifically to any special COVID funding. And we look for, some months from now to be having relatively few conversations with them about COVID. That's what we're looking for. I wish I could predict it. The other day, at the request of the Ransom city manager, we did give some COVID boost shots and some influenza shots to city employees. They are making their facility available for us for next week. And they also have a room that they've identified that we can do some things set up to have ongoing smaller activities, which would not just be booster doses for those who could need it, but could be other health activities. So we're going to continue to have an ongoing relationship with them because there's so many healthcare needs, and we've gotten them, for good reason this past year and a half to be thinking COVID, but there's so much else that we can be involved in. And, so it's going to be nice to have another site that can build and deliver some services.
Well, that's great. I'm glad you mentioned that about the presentation last week from the Board of Ed. That $20,000. You said this has been a recurring contribution over the years.
Yes, I believe this time it went from the 15,000 we've been giving to 20,000.
Okay. And since you brought up the questions, and I don't mean this to apply to Dr. Reedy in any way, shape, or form, but when people act as advisors to government and are officers, are there financial conflict forms that people have to sign in order, when you're retained for their services?
I didn't have to sign anything, but I'll be completely honest, I'm not invested in any healthcare stock. I'm more of a crypto tech guy.
That's a good thing. That's a good place to be. So is maybe at some point we should look at a policy.
I'm sure that there's some type of model policies for that.
So one conflict of interest policy that WVU and many systems have developed is that we no longer entertain drug company representatives that come in and give us pens and things like that. When they want to come and give us educational things with sponsored lunches, I don't accept that. So there's lots of money out there. There's some people that they get lunch every day of the week. None of that here. So it's we don't have an official policy about it.
But that's federal law though. Like our lab did the same thing. We can't.
Yeah, the
accept
state
or give.
But there are places that find ways around it. But we say no. And we get
They're
requests.
gonna be busted. And they keep
Usually
doing
in and around, like you said, some type of educational type program.
They have an educational program, but it's not necessarily one that we would say this is what we want our staff for.
And accepting promotional material is different actually than accepting gifts. But then there's also the investment side of it too. There's an interest in promoting a certain thing because it benefits somebody. I mean, that's another part of it too. Anyway, since it came up and we've been talking about it, it's something I think maybe we should talk about down the road.
Do you have anything else, Dr. Reedy?
I do not.
Okay. Any question? All right, we're gonna move on to environmental activity reports.
I gave you guys all an activity report that includes clinical, environmental, and threat cut. But clinical, Laura wasn't able to get me her numbers this month, so I don't have those for you in that report. Environmental, our numbers are pretty low for October, and that's mainly because I had one sanitarian, basically out of the two sanitarians that could do anything, one put in her notice. And she left at the end of October, but she didn't have anything scheduled those last couple of weeks because she had to finish up her paperwork and finish out everything that she had been working on. So really not a lot got done. The one that's training right now is she took her exam and passed it, the final exam. So the only other thing that she has to do is next week she has scheduled on the job training with somebody from the state, the district sanitarian that has to do that with her before she's able to go out and do food inspections on her own. And she will have her licensure shortly after that.
Ideally, how many sanitarians should we have?
Ideally, I would like to have 4 sanitarians.
Or,
Four and myself. So right now, what we have is, once I get another one hired, will be 3, but the problem with sanitarians is they all have to go through this training, and the training is still only offered once a year. They just finished the training, so they're
and is it
saying
just in Charleston? Is that what
that,
you're
well,
trying to
they're doing it virtually this year, and they
Oh.
are supposed to get everything uploaded to where somebody can take it basically after they're hired at their own pace. But they don't have that set up yet, and they're saying it's not going to be set up even this year. So even though they're doing it on Blackboard right now, so there's a possibility that if I hire a new sanitarian, they're not going to be trained until pretty much the end of next year.
Oh, no,
I know.
that's really.
It's a
So who's
problem.
responsible for providing the training then? And how
The
can we?
state is responsible for providing the training, so we all have to get trained through the state. It's a state program, we have to get state licensure, and we're basically, sanitarians really aren't allowed to do much until they complete that state training.
And
So
even
maybe-
if they come from another state, they still have to go through the state program.
Well, if they come from another state, if they have experience, they can apply for reciprocity if they have all their training hours and everything documented, because there's 300 some hours of training that you need before you're able to get your licensure in the state of West Virginia. So they can apply for that. That's what I did when I came on, because I have plenty of experience. So it took about 2 months for me to get my reciprocity before I was able to go out on my own. I still went through the state training to make sure I was aware of everything. Once that came up, that I was able to go and do things on my own before that. So if we find somebody with experience, which so far that was Baskin's I'm looking at, there really isn't anybody.
So we need legislation then on the state level
Yeah.
to fix this problem, because
The
that's,
the state just needs to finish uploading these things virtually and make it so it is, we have that virtual capability, because right now it's just once a year, it's the end of the year. So if you lose somebody, like if I lost somebody in October, I don't have any options.
so
really
that has to
now,
be,
so
that has to be done and made available on a year-round basis.
that it would be, you know,
Okay, thank you.
Susan, I have a question. The 2 sanitarians you're talking about, is that including Mr. Custard or no?
but he's an environmental health consultant. So he
Okay.
doesn't, he
So
doesn't
go out
do.
with you
The
anymore?
only time he goes out in the field is we did have him go out one day with our new sanitarian to give her some soils training. So he went out a lot where she was doing a subdivision, and another lot where there was a failure. So because he has all kinds of knowledge and expertise that he can help train our sanitarian. So as long as I still have him on staff, I use him for things like that, but primarily he has been used to help with the grant. So, and the food grant. So he's just doing that remotely for the most part. So we were mentors this year, and he did the mentorship training of 3 other health departments to train them in the retail food safety program, the national standards that we've been working on for the past few years. So,
Thank you.
you're welcome.
Any more questions, guys?
I do. 2 questions. One is for sanitarians, do they have to be an employee, or can we contract with somebody who is a licensed sanitarian in West Virginia to do the work?
I don't know if there's options for contracting the sanitarians. I mean, if they are a licensed sanitarian, I don't know if it would be an issue or not. I can check with the state on that, but
That's a great question.
Yeah, can you do that? Because, and maybe they have a list of, licensed sanitarian in the state, but it might be somebody who's maybe doesn't want to work full time or doesn't want to, maybe there's an option there.
I mean, it's possible, but I'm doubtful that there's actually unemployed sanitarians in the state, other than possibly retired ones that might do some consulting type work. So,
Well, it's actually a very interesting question, Karen, because What that opens the door to is for some entrepreneur to come along and start a consulting business and hire a whole bunch of sanitarians that are qualified and to send them around the state where they're needed at times when there's shortages of sanitarians. So that's an interesting thought.
I bet Mr. Lutman would know many people who can do that job.
Right. So can we have that as part of the sanitarian briefing next month, is to a follow up on that question?
Yeah.
And then also, you talked about the national standards. If you could also share with us ahead of time that document that is being utilized from the national standards perspective and any related statutory language, I think that would be beneficial to the board as well. So we're prepared for the conversation. That would be greatly appreciated.
What national standards are you referring to?
The food safety.
The one you're talking about with what Custer trains on.
It's a grant. Well, we have several grants actually to work on those programs. So you just want to know more about what that program entails, or?
Well, we just want to know what the standards are that are being utilized in the inspections. So whatever process, because sorry, I'm going to go back, take a step back. I think one of the things that's really important for us as an agency is that we follow process, and the process is consistent. And so I think it behooves all of us to understand what the process is, what standards we're following in the, meaning you are following in the field, just so I think that's part of the briefing that's going to be really important for us to understand, because when people come to us in the community and they say, well, blah, 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 this, I'm like, I don't know the answer to that, because I don't know what the process is that you guys are adhering to, what standards you guys are.
We can send you the food code as well as the legislative rules and the state law requiring septic and water. Those are all spelled
The
out in
regulations,
documents.
yeah,
They're
but
Perfect.
exciting.
Thank you.
When you're referring to standards, what I'm thinking of is the standards that we're training our sanitarians. We're trying to get our department so everybody is standardized and doing the inspections the same way. So that's what we're doing for the food program. That's the retail food, the national standards that we're working on in the food program. So it has to do with our program and our staff meeting this national standard, saying we're doing risk-based inspections, we're doing follow-ups when we're supposed to, things like that. So that's what we're trying to work on with training in our program, which becomes difficult when there's a high staff turnover rate. And it would also be difficult if we had consultants that were working with us, because it would be hard to include them in that standardization. We need to include all our staff in that.
Well, explain to them and invite maybe the board members to join when there is the next food safety meeting. And I think that's in January. For those that are new to this, there has been a food safety standard committee that was based of people through the community that are involved in food handling. And Bob Custer chairs that meeting. And these are things that are required for the food safety standards.
It is one of the things that we created as part of meeting those national standards is our food safety advisory committee, and we have quarterly meetings for that. So.
And I think the next one's in January, so maybe they can
We
notice
usually
all of the board.
update them on the progress of the standards that we're working on, because there's 9 different standards in this retail food program that we're working on, and it takes several years to meet all those standards.
Okay, thanks. Looking forward to hearing more about it.
All right. Any other question? We're going to move to clinical activity report.
We don't have our head of nursing today. So unfortunately, there's no report to be had. Moving forward, we'll make sure that that's available.
So let's have that brief next month also.
Yes.
All right, and then we have the preparedness activity report.
Yeah, sure. So a large part of what I have currently been doing is going through the contact list that we have, mostly for phone volunteers to come in and help us with the phones because they've been pretty overwhelming, the calls from people wanting COVID boosters and flu vaccines and stuff like that. So I'm encouraging people to sign up on Ready, and I've been contacting a long list of people. So far, I have about a third of the spots that I'm looking to fill between now and the end of the year, but we still need more volunteers to help us out.
So tell us again, sign up on what?
So what I'm doing is I'm having people, I want people to sign up on the Ready system, but West Virginia Ready. But if they're not signed up, and some of them are not, I have like a calendar set up and it's on sign up, and I'm having people give me their email and phone number and having them contacting them and having them sign up to come in and help us out and volunteers there. And then also, whenever we're doing vaccine clinics, I've been in charge of doing the logistics. So take insurance information and ID information. And then whenever we did the Moderna clinic out here last month, I helped set up tables and chairs and stuff like that. And then I've also been meeting with Steve Allen, and I've been meeting over at the Jefferson Emergency Services with Chief Burner. And then I have a ride-along scheduled next Wednesday with the Sheriff's Office. And then the next Wednesday after that, I have a ride-along with Independent Fire Company. It's a large part of what I'm doing now is just training and getting up to speed on, since I've only been here for 2 months.
And you've gone through many square yards of old paperwork.
Yeah, so I've been organizing a lot. Yeah.
So he's on New Caitlin.
Yes.
Yes. Mm-hmm.
I know who to go to now.
So there are exercises, threat preparedness exercises from 2009, 2010 forward. So
I'm
been
telling you, Caitlin was wonderful. So you have a very big shoe.
So did I hear right, Mason? You're looking for are you looking for volunteers? Did you say?
I am. So we have a long list of a couple of hundred volunteers. So I've contacted just about everybody on that list. And we still need people to help because people aren't available, or I have a feeling a lot of people are burnt out from volunteering previously. They may or may not want to come back.
Well, another piece which I've been finding calling others is that unlike last winter, is that now they have their normal activities back.
Yes, that's awesome.
So we're in a very different position than last winter, where they were just staying at home, and so that's very gratifying.
I find myself busier. It's not slowing down one bit.
Yeah.
But we're glad to take.
Well, if you'd like to share, I mean, if you wanted to share with us the sign up link you were referencing to the board, maybe the board, anybody that feels comfortable sharing with their own networks of, calling for volunteers. I know I'd be happy to do that on my social media and whatnot, and other organizations I'm involved in. So if that's helpful to you, please go ahead and share that with us, and we can share it along as well.
One of the big issues with volunteers is their training, supervision, credentialing. So all these pieces. Last year, we did that just-in-time training. We're trying to get this done beforehand rather than just in time, because the technical aspects are important. For answering phones, you also have to be credentialed and get passwords to be able to enter patients in the schedule if you take a call. But it is something that we're working on building in a way that we can answer all the questions about who is this doing this. It's also important to be on what's called the West Virginia Ready, REDI system.